My name is Mike Sethna. I grew up in Minnesota. I did my medical school at Mayo Clinic in Rochester. Then I did my medical internship in Boston. Then in 1997 I came here to Noran. Oftentimes the very best work one does in neurology is when you talk to a patient and elicit details of what has happened to them. Just getting the information and chewing at it and thinking about it and making progress is very satisfying. I think most neurologists would say that that's what's most appealing about the field. One of the most significant moments in my clinical career, I think, was when I remember being at the Mall of America about 10 years ago, and I developed a terrible headache, which lasted in greater or lesser form for about a month. It was just horrible. I got very, very discouraged. I mean, here I was a neurologist with a headache that wouldn't go away, and it gave me, I think, a lot of insight into what my patients go through. And my practice has been different since that time. I think the greatest satisfaction that most of us get, certainly that I get as a neurologist, is when I encounter a patient that is convinced that no one will ever get it. And this is particularly true of headache patients. There are lots of headache patients that have concluded that they're just going to, they're stuck with a set of problems. And when they perceive that somebody else understands the problem, and especially if you can then help them with the problem, that's very, very satisfying.